Hi, my name is Morgan. First of all, thank you so much for taking time to review my application. I have to say I'm so excited that the time is finally here to apply for a clinical rotation at Presbyterian St. Luke's. I've honestly dreamed of this opportunity to have a clinical rotation at PSL for many years, well before I even started the Regis DPT program. I had the opportunity to work closely with a Regis grad practicing in pediatrics that had a really impactful experience in this rotation that really positively shaped her practice. So I've been looking forward to this time to apply for a chance to have the same amazing experience that she had. I'm especially interested in this clinical education experience as I went to PT school, knowing that I have a passion for peds. Through this experience, I have also come to really enjoy working in the inpatient environment and helping patients of higher acuity along their recovery journey. Therefore, this rotation at PSL combines pediatric and inpatient experience is an opportunity that I'd be so honored and excited to have. I really feel I'm able to remain flexible in a clinical setting and stay calm and confident when some of those unpredicted situations arise. I know practicing in peds is such a dynamic environment, so I understand flexibility is so important. One strategy that I often use is effective preparation. Preparing by reviewing the patient charts in detail, if at all possible, allows me to just have a good understanding of the knowns. So when some of those unpredicted situations arise with the patients, I can adapt based on the knowledge that I already have. I also find practicing important skills often allows them to kind of become more of a muscle memory, helpful for when I need to adapt to a situation quickly. For example, while working with one pediatric patient in a hippotherapy session, she began having a seizure while on horseback. But since I'd practiced safely removing patients from the horses in case of emergency often enough that it was kind of just an automatic response, I was able to get the patient off the horse quickly and tend to her appropriately. I have found through my previous experiences that I really thrive in a fast-paced environment. As I've experienced volunteering as an assistant in pediatric hippotherapy classes and shadowing for multiple years at a peds, PT, OT, and SLP clinic, this environment is most often very fast-paced and almost chaotic at times. I find I'm able to handle these situations in a calm manner while keeping peds patients safe and engaged. Additionally, my previous clinical experience and current job in the inpatient setting have allowed me to feel comfortable with the equipment and environment of a hospital. I'm eager to continue learning in this hospital setting, and I won't shy away from the challenging tasks that often come with inpatient medicine. I will have also completed my EMT training before beginning this clinical experience, which will add to my confidence and comfort in this setting. In my first clinical rotation, my CI noted I could improve on my efficiency in my new patient evaluations, and I was sometimes taking just a bit too much time to get history before completing the necessary tests and measures. So I accepted this constructive feedback by reflecting on what I'd done in my previous patient eval, made a plan moving forward, asked my CI some clarifying questions, and then verbalized my plan with my CI just to kind of check my understanding. If selected for this opportunity, I would openly communicate with my CI at the beginning of the rotation about my preferred method of feedback while also listening to their preferred method of giving feedback. Then I would just continue to keep an open line of communication and make improvements to our system if needed. I know CIs are super busy practitioners, so I would work with them to make an efficient system for us. If selected, I would prepare by continuing to work with my research team of fellow students and faculty on our cerebral palsy qualitative study. I would review content. I would maintain my leadership role in the APTA Pediatric Special Interest Group and also utilize my resource of mentors that can help guide me to success in this setting. I will also definitely be taking the pediatric elective at Regis before starting this clinical experience. In my leadership role with the Colorado APTA Peds Special Interest Group, I will also continue leading journal club sessions and engaging in the guest lectures. I really feel I have the determination, tools, and mentorship to really maximize my prep and thrive in this clinical environment. I was born and raised right here in Colorado, and with family deeply rooted in this community, I plan to stay in the Denver area after graduation. My dream is to work in pediatrics and ideally an inpatient peds setting. Honestly, a position at PSL or in a similar environment would be such an amazing place to be after graduation. Again, thank you so much for your time and consideration, and I would really be honored to have the chance to learn from and contribute to the PSL team.